Every year, millions of older adults begin to notice changes in their memory. Maybe it's forgetting where the car keys were placed, missing an appointment, or struggling to remember a familiar name. While aging is the greatest risk factor for memory decline, it isn't the only one. In some cases, everyday medications may also play a role in changes to thinking and memory, particularly when they're used for long periods or when several are taken together. That's why today's video is so important. We're counting down 9 commonly used medications and medication groups that research has associated with cognitive changes in some older adults. This doesn't mean these medicines are unsafe or that everyone who takes them will develop memory problems. In fact, many of them are highly effective and medically necessary. The purpose of this video is simply to help you understand the evidence so you can have informed conversations with your healthcare provider about what's best for your individual situation. Be sure to stay until number 3, because it's one of the most frequently prescribed medications for older adults, yet many people don't realize it has been studied for its possible effects on memory. Before we begin, I'd love to hear from you. Tell me your age in the comments, and if you're comfortable sharing, let us know how many medications you take each day. Your experiences help others realize they're not alone. Number 9, Diphenhydramine, Benadryl. Let's begin with a medication that's probably found in millions of medicine cabinets across the country. Diphenhydramine, better known by the brand name Benadryl, is commonly used to relieve allergies, nighttime cold symptoms, and even occasional sleeplessness. Since it's available without a prescription, many people assume it's perfectly safe for regular use. However, for older adults, there's an important detail worth understanding. Benadryl belongs to a group of medicines called anticholinergics. These medications reduce the activity of acetylcholine, a chemical messenger that helps the brain with learning, attention, and forming new memories. As we age, natural acetylcholine levels gradually decline. Because of that, medications that further reduce this chemical may have a greater impact on older adults than younger people. Researchers have spent years studying whether long-term use of strong anticholinergic medications is associated with changes in cognitive function. Several observational studies suggest that older adults with higher long-term exposure to these medications may be more likely to experience memory difficulties over time. While these studies show an association rather than proving that the medication directly causes dementia, the findings have been significant enough for many geriatric specialists to recommend reviewing these medicines carefully. If you regularly use Benadryl for allergies or as a sleep aid, don't stop taking it on your own. Instead, speak with your healthcare provider or pharmacist about whether another option may be appropriate. In many cases, newer antihistamines, such as loratadine, are less likely to affect the brain and may be suitable depending on your symptoms. Number 8, Proton pump inhibitors, PPIs. The next medications on our list help millions of people manage heartburn and acid reflux every day. Drugs such as omeprazole, Prilosec, and esomeprazole, Nexium, belong to a group called proton pump inhibitors, or PPIs. They work by reducing stomach acid and can be very effective for treating reflux, stomach ulcers, and related digestive conditions. However, when these medications are taken for long periods without regular review, researchers have raised questions about their possible effects on overall health, including brain health. Here's why. Stomach acid is necessary for absorbing nutrients such as vitamin B12, along with minerals like magnesium. Vitamin B12 plays an essential role in keeping nerves healthy and supporting normal brain function. Low B12 levels can sometimes contribute to fatigue, numbness, difficulty concentrating, or memory changes. Several studies have reported an association between long-term PPI use and cognitive decline in older adults, although researchers continue to investigate whether other health factors may also contribute. For that reason, experts generally recommend using the lowest effective dose for the shortest appropriate time and reviewing long-term use with a healthcare provider. Number 7. Oxybutynin and overactive bladder medications. Let's continue with a medication that's prescribed to help people regain confidence in their daily lives. Overactive bladder becomes more common with age. Frequent trips to the bathroom, sudden urgency, and interrupted sleep can make everyday activities stressful. For many people, medications provide meaningful relief, and one of the most commonly prescribed is oxybutynin, Ditropan. Like Benadryl, oxybutynin belongs to the anticholinergic family of medications. That means it can reduce the activity of acetylcholine, the same brain chemical involved in learning and memory. Because of this, researchers have spent years studying whether long-term use may be associated with changes in cognitive function among older adults. Several observational studies have reported that prolonged exposure to strong anticholinergic medications may be linked with a higher likelihood of memory problems in some seniors. While these findings don't prove that oxybutynin directly causes dementia, they do highlight the importance of reviewing medications regularly, especially if memory concerns begin to appear. If you or someone you love has noticed increasing forgetfulness after starting treatment for overactive bladder, don't assume it's simply part of aging. Instead, mention those changes during your next medical appointment. Depending on your health needs, your provider may recommend other treatment options, including newer medications such as mirabegron, which works through a different pathway and may be appropriate for some individuals. The goal isn't to stop treatment. It's to find the option that best balances bladder control with overall quality of life. Number 6. Statins. The next group of medications often surprises people because they're among the most commonly prescribed drugs for adults over 60. Statins, including atorvastatin, Lipitor, and simvastatin, Zocor, are widely used to lower cholesterol and reduce the risk of heart attacks and strokes. For many people, these medications are life-saving and remain an essential part of long-term cardiovascular care. However, researchers have also explored whether certain statins may affect memory or thinking in a small number of people. Here's the reason this question has received attention. Your brain contains a large amount of cholesterol, which plays an important role in building and maintaining the protective covering around nerve cells. Scientists have investigated whether statins that enter brain tissue more easily might influence cognitive function in susceptible individuals. The evidence has been mixed. While some studies have reported temporary memory changes in certain patients, others have found no meaningful effect or even suggested possible brain health benefits through improved blood vessel health. Because the research isn't entirely consistent, experts recommend looking at each person's situation individually. If you've noticed new memory concerns after beginning a statin, don't stop taking it without medical guidance. Instead, discuss your symptoms with your healthcare provider. Sometimes adjusting the dose, changing to another statin, or evaluating other possible causes may help determine the best approach. Many memory concerns have more than one contributing factor, which is why a complete medication review is often more helpful than focusing on a single prescription. Coming up next, we'll examine medications commonly prescribed for anxiety and sleep. These treatments can be very effective for short-term use, but they also deserve careful discussion when they're used for longer periods, especially in older adults. Number 5. Benzodiazepines. Let's continue with a group of medications that many people have relied on for anxiety or trouble sleeping. Medicines such as lorazepam, Ativan, diazepam, Valium, and alprazolam, Xanax, belong to a class known as benzodiazepines. They work by increasing the activity of GABA, a natural brain chemical that helps calm the nervous system. For short-term use, they can be very effective when prescribed appropriately. However, researchers have found that long-term use in older adults may be associated with problems involving memory, attention, balance, and reaction time. These medications can also remain in the body longer as we age, increasing the chance of daytime drowsiness and falls. If you've been taking one of these medicines for an extended period, never stop it suddenly. Instead, speak with your healthcare provider about whether it's still the best option or whether a gradual reduction or another treatment approach might be appropriate. Number 4. Amitriptyline. Next is amitriptyline, an older medication that's prescribed for several different conditions, including nerve pain, migraine prevention, depression, and sleep problems. Although it can be helpful for certain patients, amitriptyline also has strong anticholinergic effects, meaning it reduces acetylcholine activity in the brain. Because this chemical is important for memory and learning, researchers have investigated whether long-term use may contribute to cognitive changes in some older adults. If you're taking amitriptyline, don't assume it's automatically the wrong medication. Instead, ask your healthcare provider whether the benefits still outweigh the risks or whether newer alternatives might better fit your current health needs. Number 3. Paroxetine. This is the medication many viewers may not expect to see on the list. Paroxetine, Paxil, belongs to the SSRI family of antidepressants, which are commonly prescribed for depression and anxiety. Unlike several other SSRIs, however, paroxetine also has anticholinergic properties, making it unique within its class. Some studies have reported that older adults taking paroxetine experienced greater changes in memory and attention than those using certain other antidepressants. While not everyone will experience these effects, many healthcare professionals consider this information when selecting antidepressants for older patients. If you're currently taking paroxetine, don't stop it without medical advice. Instead, ask your provider whether it's still the most appropriate choice for your individual situation. Number 2. Antipsychotic medications. The next category includes medications such as quetiapine, risperidone, and olanzapine. These medicines were originally developed for serious psychiatric conditions, but they may also be prescribed in selected situations to manage severe behavioral symptoms. Because they can affect several important brain chemicals, they may also increase the risk of drowsiness, falls, and cognitive changes in some older adults. Current medical guidelines generally recommend using these medications only when the expected benefits clearly outweigh the risks, while monitoring patients closely. Families should always feel comfortable asking why a medication was prescribed, how long it's expected to be used, and whether regular reviews are planned. Number 1. Taking multiple anticholinergic medications together. The final item isn't a single medication. Instead, it's taking several medications with anticholinergic effects at the same time. Each medication may contribute only a small amount on its own, but when several are combined, the overall anticholinergic burden can increase. Researchers believe this combined effect may play a role in memory and thinking problems for some older adults. The encouraging news is that medication-related cognitive concerns can sometimes improve when medications are carefully reviewed and adjusted under professional supervision. That's why experts often recommend bringing every prescription, over-the-counter medication, and supplement to your medical appointments so your healthcare team can evaluate the complete picture. The most important message from today's video is simple: never stop a prescribed medication on your own. Instead, use this information as a starting point for a thoughtful conversation with your healthcare provider. Together, you can weigh the benefits and risks of each medication and decide what's best for your health. If you found this video helpful, let us know in the comments whether any of these medications surprised you. Share this video with a friend or family member who may benefit from it, and don't forget to subscribe for more evidence-based tips on healthy aging, memory, and protecting your brain for years to come.